We've been watching the new coronavirus outbreak in China for some time, as soon as the first news came out. And we've actually been preparing for a situation like this ever since we had SARS in 2003, 17 years ago. And we built up our institutions, our plans, our facilities, our stockpiles, our people, our training, because we knew that one day something like that would happen again. So when this thing came about, in a way, it's a shock, but it's not a surprise. And I was away when we set up the committee to respond as the situation heated up. I was away in Davos. But when I came back and I had a chance, I wanted to come and visit to see what our preparations, our facilities, our organizations, and most of all the people, the teams who are working day and night, looking after patients, screening the suspect cases, tracking the public health, the new visitors coming in, and making sure that we have a coordinated national response to this new coronavirus, which has become a very serious problem in China, and as the WHO has recognized, is an international medical emergency. So far, we've done well in terms of catching the cases which have come in, isolating them, treating them, and some of them are here in the NCID. And the doctors tell me that the patients are generally doing well, which is good news. But we have to continue to be vigilant because the outbreak is far from over. In fact, it may still be accelerating in China. We don't know what's going to happen in other countries. It's spread to many other countries. No other country has got a huge number of cases like China so far. But you don't know how the countries will be able to react, detect, contain, and if you have, it can become a major problem for the world, and not just for a short while, but for quite a long time to come. So we have to continue to be on guard. I think that the government has got our plans together. I think we have very professional, dedicated medical and public health teams. I think that the public is very aware of the situation. We have this gov.sg WhatsApp chat group, and more than, I think, 250,000 people have signed up for the information which we're putting out on the chat group. So we're doing everything that we can. I think there's every reason to be watchful, but there's also every reason to be confident. And for each one of us to do our part, to be sensible, first on personal hygiene, wash your hands frequently, don't touch your face and mouth and eyes unnecessarily, because that's how germs get from your hands into your body. If you're unwell, stay away from work and crowds, stay at home. If you are well, go about your life as normal. You don't need a mask to go around Singapore or to be at work if you are well, because there's no community spread of the virus. And the mask gives you a false sense of security, because most of the time you don't get the virus from breathing it in. You get it from contact, and you need to take the rest of the precautions to wash your hands, to keep yourself clean, and to know when you are unwell and to stay away from crowds. So I'm very happy with what I saw this morning. I met a few of the staff to thank them personally, but there are more than 1,000 who are working in NCID, and people working all over at the entry points, the ICA staff, at the other hospitals, and all over the ministries and the SAF and the PA, who are going to be distributing the masks this weekend. I think if we work together, we can overcome this challenge. I have every confidence of that.